Hi, I'm Gokul Kanda Swamy. I'm one of the Consultant Urological Surgeons in Swansea Bay University Health Board. I also do my private work here at Sancta Maria Hospital in Swansea. The TURP stands for Transurethral resection of prostate. I think the name describes the procedure itself fairly well. The procedure is carried out transurethrally and we resect the prostate to make the channel bigger. So essentially it's a procedure done for patients who have difficulty in passing urine purely because of prostatic enlargement. And in those patients who have failed on certain other management, finally end up in having a surgical procedure. And we do TURP in those patients to make the channel bigger so that they can pass urine freely. When prostate enlargement starts to happen, people experience symptoms very differently. Some may notice just that the flow is getting poorer, which obviously is easy to correlate. But there are quite a few other symptoms which may indicate that it's the prostate enlargement that's giving the trouble. And that may include things like difficulty into starting to pass urine. And once you start to pass urine, it may not come in one single flow. You may have to stop and start, or you may have to strain to finish passing urine. And sometimes when you finish passing urine, you feel as if you haven't emptied well. You feel you have to go back again. And in some patients, the symptoms can be completely slightly different, like they're going quite often to pass urine, or inability to control when they have the sensation to go. That's called as urgency. And sometimes people start waking up in the night time. That's called as nocturia. So all these symptoms can be a marker for the prostate enlargement that needs some attention. So when people come to us with these symptoms, we evaluate them first, and generally we start them on medical management. With a lot of advancement in the drugs that we have today, most people will just respond simply to the medications alone, and that should be fine. If they fail to respond to medications, that's when we think of surgical options, and TURP at the moment is the gold standard surgical treatment option. TURP as a procedure has been in practice for nearly 40-50 years. This involves passing a metal scope through the urethra, the urinary pipe, up into the bladder, and then we examine your prostate and the bladder first, and then we start shaving off those parts of the prostate that is growing and blocking the flow of urine, i.e. the urethral channel. It usually takes about an hour to resect the lobe, and hence you need a full anesthetic for the procedure, either in the form of a general anesthetic or a spinal anesthetic, which is an injection in the back. And after the procedure, the patient will have a catheter placed, and most of the time there will be a fluid going in and out of the bladder called as irrigation to keep the catheter unblocked so that there is a free flow of urine, and also making sure all the blood and all the surgical fluid is all drained properly. And usually the catheter stays for a couple of days, and the patient stays in the hospital for those 2 days. So when you are in the hospital for the first couple of days, you will have the catheter, and we generally expect the catheter to come out on the second day after surgery. That's when the urine becomes clearer and the need for all this fluid and irrigation stops. So 90% of the time you go home without a catheter. After taking the catheter out, we check how you pass urine, make sure you're passing urine well, and then we send you home. After you go home, you need to remember that there is a big raw area in the area of prostate where we have shaven it off, and that needs time to heal internally. So you may notice some discoloration of blood in the urine, and you may notice some burning and stinging while passing urine. And generally these things last for somewhere between 3 to 6 weeks, depending on individual patients. And the key thing during this time is recommend patient not to do anything strenuous, as it can precipitate bleeding from these healing areas. So TURP, even though it's an endoscopic procedure, it is still considered as a major surgery. So with any major surgery, some risks are associated with it. But as I also said, this procedure has been in practice for more than 40-50 years. So we know very well with this, over these years and years of practice, what these risks are. And our surgical technique have modified over the period so much. And these days, practically, the major risks associated with the surgery, we see them far less than 1% of patients. We do TURP here at Sancta Maria Hospitals in Swansea, along with a wide range of other urological procedures as well.